Are COVID-19 measures being lifted too soon? Many countries are now ending their travel restrictions, mask mandates, and testing requirements. So how will scientists stay on top of the pandemic? This is Inside Story. Hello and welcome to the program. I'm Mohammed Jamjoom. It's been more than 2 years since the global pandemic began. And in that time, an estimated 500 million people have tested positive and more than 6 million have died. But as infection and death rates appear to slow down, many countries are swiftly removing their COVID-19 measures. Singapore is the latest to scrap coronavirus tests for vaccinated travelers and remove nearly all limits on gatherings. In Europe, Switzerland and Greece will follow most of the continent to remove travel restrictions by next month. Many countries have also eased rules on wearing masks and self-isolation if someone tests positive.
Delta position is masks will be optional this evening for all crew and passengers as well. So it is cause to celebrate.
In the U.S., travelers ripped off their masks in midair after a federal judge struck down a mandate to wear face coverings on public transport. The judge said the Centers for Disease Control had overstepped its authority. Some scientists are concerned by moves like this, since the contagious BA.2 variant is spreading quickly around the world. The White House has launched an appeal.
The Department of Justice, as you noted, has indicated that they would appeal, not just because they think it's entirely reasonable, of course, to have this additional time to look at it, but because they think that the for current and future public health crises, we want to preserve that authority for the CDC to have in the future.
As wealthier countries remove their restrictions, developing nations are still struggling to vaccinate their people. The World Health Organization has called for 70% of the global population to be inoculated by June. But so far, just more than 3% of people in lower-income countries have received at least one dose, compared to 60% in wealthier nations. And the world's most populous country, China, continues to pursue a so-called zero-COVID policy to eliminate all transmission. Its biggest city, Shanghai, has tightened its lockdown. 25 million people have been stuck indoors for 5 weeks. Videos of people protesting against the measures and being forced into quarantine have triggered outrage on China's highly censored internet. All right, let's bring in our guests. In Oxford, UK, Peter Drobac, director of the Skoll Center for Social Entrepreneurship at the University of Oxford. In Boston, Maaza Seyoum, Global South Convenor for the People's Vaccine Alliance, which is dedicated to the equitable distribution of vaccines around the world. And in New Delhi, Dr. Ravi Malik, chairman of Radix Hospital. A warm welcome to you all, and thank you so much for joining us today on Inside Story. Ravi, let me start with you today. Many countries are now ending travel restrictions, mask mandates, and testing requirements. From your perspective, is this all happening too soon?
I think it is a time to come. We should review country-wise where the epidemiologically the corona is more prevalent and which countries it is less prevalent. If we see the statistics, even in last 24 hours in US, we have witnessed around 60,000 cases. In India, we have witnessed 2,500 cases. And in UK, we have witnessed around 50,000 cases. Now, it all depends what is the epidemiological numbers, what is the data which is there prevalent in the countries. So I think the life should normalize, but the countries where it is very prevalent, where it is more infectious, there we should pose some kind of restrictions. But in the countries where it is less prevalent, so we should fine tune our strategy. We should recalibrate our strategy as per with that data which is prevalent, epidemiological data which is prevalent in that country. So we cannot give a single statement as a professional. I can tell you, we cannot give a single guideline or a statement for the whole world on the whole. So what I feel as a professional is that we need to see what is the epidemiological disease severity and disease prevalence in a particular country for that matter. But having said that, as a professional, I must say that we should all take precautions. It is an extraordinary, unprecedented type of a situation where we are in. It is definitely an unpredictable disease. So we need to take all the precautions of social distancing, mask, and other things.
Peter, what about you? From your vantage point, are COVID-19 measures being lifted too soon? And also, how dangerous might this be?
Yeah, well, as Ravi said, we see quite a bit of transmission in most parts of the world right now. What concerns me is that we seem to sort of be all or nothing, and the so-called living with COVID approaches that we're seeing really are trying to return us to a pre-2020 normal. And the reality is there will be no pre-2020 normal. We're not going back to that. COVID is circulating at high levels. It's still far more deadly than the flu, for example, and it causes significant long-term effects in 5 to 10% of people, effects that we don't really understand. We have to remember that this is an airborne virus, and therefore I think that there's a middle ground where continued availability of rapid testing, use of masks in high-risk, crowded, closed indoor spaces, investments to improve ventilation, all of these things can save lives, can keep people at work and in school, and help protect us against COVID. Nobody's saying we need to go back to lockdowns, but to throw everything off, I think, is misguided.
Maaza, last year the World Health Organization had set a goal. That goal was to ensure that 70% of every country's population was fully vaccinated. Why are we so short of meeting that goal?
Well, I think there are a few things. One, the program that was set up, the COVAX program that was set up to distribute vaccines in an equitable manner, was a good idea, but in practice did not work. What happened was that the wealthier countries jumped the queue, went directly to purchase vaccines from producers, and that meant that vaccines were then not available for low and middle income countries. We still have quite a bit of intellectual property barriers in place that are preventing manufacturers that are available and ready to make these vaccines, the mRNA vaccines that are more effective against Omicron and have protected people all around the world. So manufacturers are ready to make those and are being blocked from making them. We had seen quite a bit of hoarding as well, where rich countries were saying that they would share and had not shared in time. So it's a variety of issues. And now that vaccines are somewhat more available, we need to make sure that we keep that system flowing in a way that makes sure that it's equitably distributed.
And Maaza, I just want to talk for a moment about the impact that all of this has had on developing countries, on middle and low income countries. I mean, you're talking about hoarding of vaccines by wealthier countries. You're talking about this barrier about intellectual property not being lifted. There have been so many calls from so many groups in so many countries over the past year and a half to lift these requirements, to lift these restrictions, to make sure that hoarding doesn't happen. How dispiriting is it to you that this is still going on? And what kind of an impact is it having on these poorer countries?
It is really, really dispiriting. I mean, to think about the fact that in high-income countries, over 70% of people have been fully vaccinated, and in low-income countries, it's about 12% of people fully vaccinated. In my own country of Ethiopia, only 19% of people fully vaccinated, and there are still 8 countries around the world, the last time I checked, that are lower than 5% fully vaccinated. So you can imagine what that means when healthcare workers, grandparents, people who are immunocompromised have not had access to this protection. Something that does really worry me and all of us at the People's Vaccine Alliance as well is the fact that the numbers are not accurate. We've heard stories about the death rate not being as bad in Africa as it is elsewhere. And the truth is that when we are in a system of vaccine injustice, we're also in a system of diagnostics injustice and treatment injustice. So there are a lot of cases of COVID that have also gone undetected. The impact to low-income countries is, Mohammed, really hard to fathom in terms of the economy, in terms of what this has done for other health issues, like tuberculosis, access to HIV treatment, antenatal care, and also just the impact on women and other marginalized groups.
Peter, I saw you nodding along to a lot of what Maaza was saying. I'm going to let you give your reaction and jump in, but I also want to ask you, how are scientists going to stay on top of the pandemic if mandates are being dropped and countries aren't testing as much? I mean, how will they be able to actually stay ahead of the curve on this?
Thank you. Just to build on the vaccine inequity issue briefly, I think the fundamental flaw here is that we're still approaching this with a charity model rather than a solidarity model, that in wealthy countries, we're taking care of ourselves first. We're happy to give leftovers, to give aid, et cetera, to poor countries, rather than understanding that this is a global crisis and therefore these vaccines are a global good. And if we look at it through that solidarity lens, that allows us to take the technology and the manufacturing that capacity that exists and get it out there, understanding that this makes all of us safer. So we really need to shift that. And I think as we face more global crises like climate change, that's the sort of approach that we need to take. Now, with respect to surveillance, it's critically important that we continue to have disease surveillance, not just in one or a few countries, but really all over the world. We've seen just in the last couple of months, just since the Omicron wave, which started in about December of last year, several different variants, BA1, BA2 in particular, and then some others as well that haven't proved as significant. This particular coronavirus mutates a lot more than we expected or suspected it might, and that's going to continue to happen. And so we need to stay on top of this. The other thing is that investments in disease surveillance are going to be an important part of protecting us in the future from other pandemic threats that inevitably will come. So early detection, being able to sequence it, helps scientists stay proactive rather than reactive. We need investments really globally in this.
Ravi, I want to ask you specifically about where things stand currently in India with regard to the numbers of cases and also with regards to ensuring that people in India are vaccinated.
As far as India is concerned, we have vaccinated around 187 crore. Almost 1870 million of the population has been vaccinated, and 61.4% of the population has been completely vaccinated. We have given booster dose to 1.8%, and at least one dose has been given to almost 72% of the cases. This is the latest report from the Ministry of Health from India. So India has done an incredible job as far as the speed and spread of vaccination is concerned. So giving 187 crores of vaccine, and last man in the line is also getting the vaccine. We have a good distribution system. As far as the vaccination is concerned, we are on a firm footing. And even in last 24 hours, we have vaccinated 20 lakh of people. As far as the testing is going on, almost 4.5 lakh people have been tested for COVID. We agree that we are a developing nation and we have certain limitations as far as our infrastructure is concerned, number of availability of beds is concerned, and other manpower health resources are concerned. So we have certain constraints, and we appreciate that fact. That is why we are trying to give more attention on the preventive aspect. Now, very important thing which previous two of my panelists have said, we cannot be globally secure unless we vaccinate each and every person on this earth. So to get a global security from this monstrous illness, we need to vaccinate even the developing nation, each and every individual. So only then we are going to get our full security, because we are all tied up with a human chain. So if, as far as the vaccines are concerned, I think it is very important aspect to give vaccines to the developing nations also, those who have not been vaccinated. As one of the panelists has rightly said, that only 5% or 12% of the population has been vaccinated in some of the countries. So that is a matter of concern as a professional to me.
All right, I just want to take a step back here for a moment. One of the most pressing health issues is what's being called long COVID. While most people recover quickly, some experience symptoms for months or even longer. We spoke to one sufferer who can no longer lead an active lifestyle. Take a listen.
Hi, I'm Nidhi Prakash. I'm a reporter in Washington, D.C., and I've been dealing with the effects of long COVID for more than 2 years now. So I initially got sick with COVID in April of 2020, and it's been an uphill battle since then. I was knocked out for about 2 months and then had a stop and start of getting back to work, crashing, getting back to work, crashing. And when I say crashing, it really is debilitating. It was extreme fatigue, headaches, chest pain, a recurrence of other symptoms like throat pains and things like that as well. I ended up having a really bad crash in January of 2021 and was knocked out for about 7 months, really very, very debilitated, pretty much bedridden for a few months there. I'm lucky in that in DC there is one long COVID clinic, and after a wait of several months I was able to get an appointment there. That's been a lifesaver for me, and I know that's something that many millions of people don't have access to. So I guess my main concerns right now as someone who's gone through this for so long are that I don't know that world governments are really prepared for the kind of medical and social cost of this. I've also been really lucky that I've had a supportive workplace where I've been able to take the time off that I need to slowly, gradually recover. Again, I know many, many people don't have that kind of support and actually are going to start relying on disability. The US government, at least, is still grappling with what that means in terms of long COVID. Is it definitely a disability? What qualifies someone who has long COVID as being able to get disability payments? Things like that are serious questions that we need to be asking ourselves, in addition to setting up more clinics with better access for people.
Maaza, I saw you reacting to the testimonial that we just heard there. From your perspective, has there been enough support offered to those who are suffering from long COVID?
You know, as I was listening to her, and it sounds devastating, I was thinking that given the lack of diagnostics that we've seen in a lot of low-income countries, my concern is the fact that this is going to be an added burden to health systems that are already pressed. You know, that we actually don't have a good idea in a lot of low and middle-income countries of how many people have been infected, and what does that mean for then the people who will be suffering with long COVID. You already have these really strained health systems. So, the only data I've seen in Africa about long COVID is from South Africa. And it makes me think, what is happening in other countries where we have not diagnosed people enough. So I would say that we're probably not giving enough support. I'm glad to hear that she had some of the support that she needed, but it sounds really dreadful.
Ravi, have you seen that governments around the world have taken long COVID seriously, or do you think that it's being largely underestimated?
Since I run a COVID unit in my hospital also, what I have seen is a lot of patients, you have rightly pointed out, a lot of patients have suffered long COVID. May it be respiratory issues, may it be cardiac issues, for that matter, weakness, lethargy, and for that matter, even post-traumatic stress disorders, and so many things they have propped up. And I think it is a little underestimated because a lot of patients, especially those who are elderly, or those who already had immune system compromised, or those who are diabetics, or those who are suffering from heart disease, and over that they got COVID. They have definitely gone through the long COVID. And I think the prevalence of this long COVID is to some extent, by and large, I will say that it is ignored by the governments also, because they are more focused in saving the life of people. But I think that this issue needs to be stressed even more diligently, and we should look into these problems also, because a lot of patients are suffering from long COVID and the symptoms are persisting for maybe 1.5 or 2 years. And those who have got permanent lung damage, maybe the symptoms are likely to continue for a much longer time. So I think a rehabilitation program should be started by all the governments, and many governments are giving attention to that also. But I think this problem needs to be addressed more carefully. Maaza has rightly pointed out, and you have shown a right picture of that lady also who is suffering from post-COVID symptoms. So this needs to be addressed, and I must congratulate you for propping up this issue. And since I run a hospital, so I see a lot of patients, they have been suffering from post-COVID complications, and they need rehabilitation programs.
Peter, Maaza was speaking a few moments ago about the stress that health systems worldwide have been under since the beginning of the pandemic. You know, we're talking a lot about the fact that countries are dropping mask mandates and travel requirements, and many countries are almost acting as though COVID-19 didn't exist anymore in some sense. How much are health systems currently being burdened by COVID-19?
I think it remains significant. And of course, COVID has always sort of moved in waves. We see waves of cases and infections that sort of come and go. Right now, we're on the back end of the Omicron BA.2 wave. But each time it hits, even in places where there are high levels of vaccination and people are less likely to get real sick and go to hospital, just by virtue of the sheer number of infections, that's absolutely stressing healthcare systems. On top of that, we have massive backlogs of cases and folks who haven't been able to get the attention they need for other conditions. On top of that, we have healthcare workers who themselves, of course, are out sick. And as Maaza pointed out, in some low and middle income countries, healthcare workers who themselves have not even been vaccinated yet. So all of these things are piling up. On top of, I think the final thing is just the burden of exhaustion, fatigue, burnout, and trauma that healthcare workers have faced by being on the front lines of this now for 2 years. So we really need to address this, the resilience of our systems. And again, smart investments in our healthcare workers and in our healthcare systems will not just help us with COVID, they will help us keep people healthy moving forward.
Ravi, how concerned are you about potential future variants of COVID-19?
As a professional, I'm definitely concerned because right now BA 1.21 or 2 again is it is highly spreadable type of a virus. So the new strains of viruses which are coming, we need to be extremely vigilant on the genome of these viruses, the behavior of them, the virulence of them, the killing capacity of them, and of course, the transmittability of them. And we should also fine-tune our vaccines as per with the strain which is coming. So as a professional, definitely, we are worried, we are concerned. The way the virus is changing its genomes, we all need to be absolutely concerned. But having said that, one thing is clear, on the face of it, most of the variants which are there, the variants of concern, they are taken care by the available vaccines. We cannot prevent illness in every vaccinated individual, but we can prevent a serious disease and we can prevent people going to ICUs and the subsequent deaths in those people, those who have been vaccinated completely along with the booster dose. So I will like to bulldoze my clinical opinion that everyone should get the vaccination done, whether in developing nation or in developed nations, because it is definitely going to offer protection against the variants which are right now there. World over, the genome specialists, they are keeping a vigilant eye on the changing genome of this monstrous virus. And we need to be extremely careful. And in India also, our epidemiologists are keeping a vigilant eye on the behavior of the virus.
Maaza, do you believe that the effort to get people vaccinated has lost momentum around the world? And if so, if you do believe that, what are the implications of that? What does it mean if the world is, in some sense, giving up on achieving high vaccination rates?
You know, the fact that $5 billion was cut from the US's, global support for COVID recently makes me think that, kind of echoes what you've said, that the world, some parts of the world seem to think that the pandemic is over, and it absolutely is not. And, I think the impact of this obviously is one that we don't know. And, I'll defer to, Dr. Malik here, who's the clinician, but I've heard a lot of people say that there's nothing to indicate that the next variants will be milder. I've heard some people say, Omicron might have been more infectious, but it was milder than Delta. So this is the trend that we're going in. And I hear from experts that there's nothing to say that that is the case. So we do risk the potential of a more deadly variant popping up. Something referencing what Peter said is also looking to the future, with these intellectual property barriers, with the fact that there are manufacturers all over the world that are ready to make these vaccines and have not been given the tech or the know-how to do it. And that, big companies like Pfizer and Moderna, despite the fact that they've received billions of dollars to produce these vaccines, are still refusing to support manufacturers around the world. This will have an impact not only for this pandemic, but for future pandemics as well. At the moment, Africa produces only 1% of the vaccines that the continent uses, produces only 1% and has to import 99%. And we need to think about not only now future variants that might pop up for COVID, but also for pandemics that we have yet to see.
All right, well, we have run out of time, so we're going to have to leave the conversation there. Thank you so much to all of our guests, Peter Drobac, Maaza Seyoum, and Ravi Malik. And thank you, too, for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed Jamjoom, and the whole team here in Doha, bye for now.